Now, let's talk about a little question. What accessory reproductive gland do both men and women have in common? Think about it. So it's not a part of the actual reproductive tract, but it does help in reproduction. And men and women both have mammary glands. As you can see that many of the things like fatty tissue, areolas, nipples, and ducts, the men and women do have that, but look at the like definitely different proportions and sizes as well. So let's talk about the mammary glands. I think your book doesn't even have a whole page on it. I think this is like really cool topic. And why? Because again, it's actually much more complicated than it looks at surface value. So let's talk about superficial anatomy. So what we see here is, so often you see this and you say, oh, it's a nipple. Well, yes, the nipple is the center part right here, the raised part. But that's the nipple and the surrounding pigmented colored part that's different from the rest of the skin around on the mammary gland and breast. So this nipple is the site of the openings of the mammary gland. Now this colored part is what you call the areola. So this is the reddish brown, again, depending on your skin tone, it could be any different type of color. But compared to the surrounding skin around the areola, it's typically a different color than the rest of the chest area or thoracic area. So again, the areola, that's the area surrounding it. So if you say it, sometimes people say like, I have big nipples, and it's just like, okay, are you talking about this part right here? Like it's really big, or are you talking about areolas? So again, areolas and nipples, they're part of the same structure. They're part of the mammary gland, but they are different structures. They're not one and the same. Okay, so then areolar, and then you see all these little bumps right here. These are what we call areolar glands, or commonly Montgomery's glands. So as you can see, they're not some sort of weird STD. They are not some sort of pathogen. These are normal. So if you do have these, don't worry about that. They are normal. So what are they? So they actually are some sort of sebaceous glands. So what they do are modified sebaceous glands. So they secrete these oily secretions. And what's the whole purpose of these secretions? Well, the thing is that if you're a woman and then you're pregnant or you gave birth and you're nursing, what happens if you have that little baby suckling on the nipple all the time? Well, the thing is that, again, all that friction can eventually result in chafing and also like making it very rough and sore. So it actually lubricates the nipples, especially during nursing. So again, both men and women do have Montgomery's glands. So you do have little oily secretions that makes it a little less prone to chafing and chapping. So both men and women, unless it's a woman with a really hairy nipple, as you can see, this man does have little nodules, but again, these are not pathological. They're not disease. These are Montgomery's glands. Now, men have nipples, right? So why do men have nipples? So again, nipples can vary in size. Again, we're not talking about nipples is the part right here. This guy has big areolas right here, and this guy here, he has a nipple, not much of an areola. So as you can see, maybe women have a variety in nipple sizes, shapes, colors. So do men in terms of nipple and areolar shape, size, and colors. But why do men have nipples? So again, and this is Mark Wahlberg. So again, before he was battling Transformers, one thing is like he was like back in I think the 80s or 90s, he was kind of like a teen pop idol. He was like a rapper, and then one thing is that he has actually a third nipple. And this is okay, don't at me if I get this wrong. I think it's Harry Styles from One Direction. And look at this. He actually has one up on Mark Wahlberg. He has the third nipple and the fourth nipple, and he has confirmed it. Yes, he does have four nipples. So one explanation people posit, and it's mostly true, but they say, okay, you started as a girl, so it's like, okay, wait, what? So there's a saying going on the internet and a lot of these articles, everyone starts out as female. Now, the thing is like, and you can see many articles, if you just look up, okay, everyone starts out as female. So it's not quite, there is truth behind it, but it doesn't tell the exact whole story. So we have to go back. Let's move away back from reproductive cancers, and now let's talk about development. So the thing is that what you have here, fertilization, now we have embryo, now we have fetal development. So between embryonic development and fetal development, something happens. So around 11 weeks, this is when genitals start to develop. So actually before 11 weeks, when you're in this embryonic stages right here, There is no real genitals. There's no real male and female genitals. It only happens after around the 11th week. So this fetus has genitals hard to see in this picture, but again, you don't have genitals from the start. They have to develop. Now again, men, again, what do males have? They have that Y chromosome in humans. So the thing is that what we have here, this is a embryo that's developing, and what we see is that we don't quite have a male or female anatomy. So we have this genital folds and genital tubercle. So it's a little bump, a little bit of folds of tissue. These are not a penis and vagina yet. So what we have here? What does the embryo think it is? Well, right at this stage, before 11 weeks, it's neither male nor female. So what needs to happen? So remember those X and Y chromosomes? Now we have to talk about that. And I did mention, so the X chromosomes, remember, if a fetus has two X chromosomes, it'll develop, and assuming everything else is normal, it'll develop into a female. So what happens here? If you have two X chromosomes, then this should happen. So it goes from this genital tubercle, and then you get the glands forming the clitoris, and then these genital swellings and folds become the labia. Now, if you have an XY, then that embryo eventually develops into a male. So the colors here are very interesting. Notice that, again, they start off from the same tissue, but depending on the chromosomes, they either form different shapes. So you either form a penis or an intestine and scrotum, or you form a clitoris and the labia. Now, what do we have here? So the thing is that female, male homologues. So when I talk about homologues, these are tissues that develop from the same original tissue in embryos. It's just when those sex chromosomes kick in, that's what determines whether it develops into the female version or the male version. So the female version of gonad, again, is ovaries. So testes actually develop from the same original tissue. It's just around that 11-week point that the embryo develops either an ovary or testes from this tissue. And then the fimbriae, these are actually the little fingers that are right coaxing the egg from the ovary into the fallopian tubes. So the fimbriae also have an analog in the testes. It's an appendix testes, very small structure. Don't worry too much about it in this class. But things like glands, so again, there are female secretions in the reproductive tract. There are male secretions. Again, these are two of the ones that help to make semen. So as you see, that they actually develop from the same tissue, and they actually have similar functions in terms of just making secretions. And then the labia majora and minora, folds of skin, same in men. Now, instead of being folds of skin, now they're a pouch of skin. Actually, the labia minora forms the skin of the penis. And the clitoris, and this is again, this is why the clitoris is erectile tissue. Again, things like the penis is erectile as well. So there are similar, even though the overall final shape is different, in terms of what they develop from, in terms of their nerve control, they are very similar. And the clitoris and foreskin, again, this is also known as a prepuce in both sexes. And the glands, again, you have a head to the clitoris and you also have a head to the penis. So again, these are showing that this sex determination based on chromosomes is very important in determining what sets of external and internal genitalia an individual develops.